Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine. Again, welcome to our parent program. Remember that these videos do not replace appointments with your pediatrician. If you have questions, give us a call here at 359-7111. We'd be happy to see you same day. So today, we're going to talk a little bit about ear infections and what they are, and help to kind of classify ear infections a little bit for you in a way that maybe you've never thought of them before. Ear infections really are divided into three separate types, and this is important to understand. There are what are called inner ear infections. This is actually in the neurologic portion of the brain or of the ear, and it's deep within the bone. These infections cannot be seen on physical exams. When you look in the ear, you do not see the inner ear. These infections are particularly scary. They result in significant hearing loss. They result in severe dizziness. The good news is assuming that's what's going on, they're usually self-limited. But they're very difficult to pick up. They're also very rare. The next group of infections are middle ear infections. They're the most common by far, and when we talk about an ear infection for Johnny who had fever and was tugging on his ear or with fluid coming out of his ear, that's probably what we were talking about. We're going to come back to those because that's really what I want to talk about today. The last set of infections are outer ear infections called otitis externa, sometimes called swimmer's ear, and that affects the tube in the ear as well as the floppy part of the ear, the parts that you can see. But it affects the tube itself. These infections are usually caused by getting water in your ear. They're most commonly associated with swimming in the summer. They can be treated just with drops, usually some steroid drops or some antibiotic drops to help decrease the inflammation in the canal. There is a fourth type of infection. That's an infection on the drum itself called Bolus Byringitis. Bolus Byringitis is particularly painful. It is easily treated with certain antibiotics and is not part of your usual group of ear infections. So when your child has a whole bunch of ear infections and we say, or you hear a doctor say, one more ear infection and we need to put tubes in, if you have a Bolus Byringitis or an external ear infection, those really aren't the infections we're talking about, so we don't worry about those. An extra one of those is no big deal. What we're worried about is an extra middle ear infection. Those are infections behind the drum, which is what we look in with our special flashlights, and look back there, we can see that. That's pus that's trapped in a very, very small space and very difficult to treat. Antibiotics actually don't get in there very well, so it's easy to miss. They're not able to adequately treat those infections, so we wind up doing multiple courses of antibiotics sometimes. If the pressure builds up too much in there, the eardrum might rupture. That is not the end of the world. A ruptured drum alleviates the pressure, and with that often alleviates the pain. The child feels better. If we have an infection that we cannot treat, or if you have multiple infections, what we do is take your child to the operating room with a surgeon. The surgeon will anesthetize your child. He will make a small rupture in the drum and then put tubes in so that that rupture doesn't close up for 6 months. So a rupture from an infection is not the end of the world. Sometimes we surgically do that for the child. These infections can be caused by any of a number of bacteria or viruses. They may or may not respond to antibiotics, and again, can be rather difficult to treat. But I want you to be able to, when you're thinking about infections, we'd like you to be able to understand that there's in fact three separate types of infection, and we want to categorize them different. They're not all the same. So just as all sports cars aren't the same. So hopefully this helps to kind of shed some light on some things for you. This is Dr. Windisch. We'll see you next time. Again, if we can be of help here, give us a call at our office, 359-7111.